Welcome to New London Hospital. I'm your host, Elizabeth Durazio, joined by Tom Manion, the president and CEO here. And we're going to talk about the future here of healthcare in the community, both the good things and some of the struggles that we've seen with COVID-19, and maybe some positive outcomes for the future that we didn't quite expect. Thank you for joining me, Tom.
Thank you.
So certainly this spring has definitely been a wake-up call for the medical community at large in all aspects across the entire country. And New London Hospital, again, embraced the changes for COVID, made things cleaner and more efficient in terms of how to deal with screening people coming in and out for procedures. As we go into the future, what are some things that you can see that perhaps maybe COVID taught us a lesson?
Yeah, great question. So I think one of the really, I'll say silver linings from COVID, COVID isn't a good thing, but one of the silver linings that we are seeing as a result of this, I think things like telemedicine are here to stay. So, for example, with us, you need to call your primary care provider and you can set up an appointment, but we can do something where you can go on our website. There's a link to our portal, and you can go in and click. It's just an easy two-step link to click on your virtual practice for a telemedicine visit, who you want to see, and you go into a virtual waiting room, and your providers can come and see you. All of our providers now have they're set up for doing telemedicine visits in their offices, and it's great for people who aren't really safe to go outside. So people who are going through chemotherapy, or people who have other significant chronic diseases that make it so that it's really difficult for them to leave the home. Those are things that are going to be fantastic for us going forward. Our screening protocols, how we make sure we take care of each other. I'll say one of the interesting things, our flu season last year ended about 3 months earlier because of COVID, because everyone was masking up and not touching each other, So the microbes weren't being shot around nearly as much.
Right, that's a huge positive.
And so, I think it's crucial that people still get the flu shots, and I think it's crucial because you can still get COVID and the flu at the same time.
And looking forward to the fall, although we're still waiting for the COVID vaccine or perhaps other prophylactic treatments that are being worked on, the realistic thing is it's not going to be ready October 1st when this could possibly hit. So the importance of we have to make sure as many people get their flu shots as possible. We need that immunity, but also we can't be flooding our ERs with so many people with the flu that when COVID, or if it does start to upswing, we're not ready.
Right, and the symptoms of the flu and COVID are look almost exactly the same, with some variations, obviously, but it's going to be hard to tell. And then the other part of that equation is testing and swabs. So there still exists a shortage of some testing, whether it's the medium or the actual swabs themselves. We are working on stockpiling those as quickly as we can, but all the more the reason, get your flu shot. That way you can hopefully avoid catching anything and having to come in to be tested. But if you do get symptomatic for either reason, we're here. We have a drive-through setup screening protocol, but we need to create an appointment for you. We can get you in and make sure we test you in a safe and responsible way.
One of the things that COVID sort of caused all hospitals to do was really look at streamlining procedures, like what would happen when you have staff out and things like that. Did New London Hospital feel that impact? Yeah,
so absolutely we did. And one of the things that was really important for us is that if you felt even potentially ill or exhibiting any of the symptoms, we did ask staff to stay home. It was critical for us that we kept anyone who may come in through our doors, whether they're a patient or an employee, out of these doors, because we do have people who are very sick here who are still in the hospital, and we don't want anyone to spread that through some sort of community spread here in the hospital. We haven't had any community spread within our hospital, thankfully, and we, like I mentioned before, I can count on one hand how many patients who have actually come through our ER who have had COVID. And I'll also put a finer point on this. Where we are currently in our surge level, we send those patients to Dartmouth. So those patients don't stay here. So we again have a very clean and ready hospital to take on anyone who has healthcare needs.
And that should put all of us at ease as we go into the fall and as we look at perhaps another insane flu season. Make sure you get your flu shot. Come here to your regular providers at New London Hospital because they've learned the lessons of COVID, and going ahead there is a game plan to keep us healthier and safer.